Hi, it's Carly with Annapolis Area Doulas again, and I have Kelsey with Personalized Physical Therapy here today.
Yeah, thanks for having me.
We're excited. So we're going to talk today about something that does not get discussed enough, which is diastasis recti. And I personally have dealt with this myself, and I was completely unaware that I had it until a midwife friend pointed out in my 4th pregnancy when I set up that she could see a big separation. So I asked Kelsey to come tell us a little bit more about it today to help understand what it is and what we can do about it. So Kelsey, do you mind just telling us what it is exactly?
No, not at all. So your largest abdominal muscle, it's called your rectus abdominis. You have a right and a left portion. It goes from your rib cage down to your pubic bone. So it's the muscle that's commonly referred to as your six-pack muscle, before we had children. And it is the muscle that flexes your trunk. So a crunch or a sit-up, it helps, if you're laying down and you go to sit up, that's the muscle that you're using. So it's a right and a left half, and it's in the middle, it's connected by connective tissue. And when you're in the later stages of pregnancy, just because your belly is growing, it's not unusual for those right and left parts of that muscle to start to separate more and more. That connective tissue called your linea alba is under a lot of strain. So it's not abnormal for it to separate. It's abnormal for it to still be separated beyond 12 weeks postpartum. So normally it should come back together. I'm glad that you mentioned that it took 4 babies before somebody pointed it out. I've been a physical therapist for 10 years, and it's one of the most common, I would say, underdiagnosed conditions. Most doctors don't check for it, and even the ones that do don't really tell you what to do about it.
So could you tell me what kind of issues it causes? Because I wasn't aware that even if I had it, I have no idea what that means in terms of what could happen.
Yeah, so unfortunately a lot of things can happen because of it. One, you're just left with a lot of core and trunk weakness. So not having a good stable base puts a lot more strain on your back. It can contribute to back pain. It can make things like pelvic floor weakness and incontinence even worse. And then all of your bigger joints, so your shoulders, your hips, your knees, they all rely on a good stable foundation for them to have good mechanics and alignment and to work properly. So any kind of instability in the trunk is going to lead to excessive strain pretty much on every other weight-bearing joint. And in really severe cases, you can actually get a hernia, so where your organs actually start to protrude through that separation. So nothing good can come of it. And if it doesn't resolve on its own, it usually will keep getting worse with each subsequent pregnancy. So it's something that it's really good that you could start some core strengthening. Not only you can do a lot of these exercises while you're pregnant, but then to get started on them right away in your postpartum period so that you can you can already start the healing of that and hopefully help prevent it. Exactly.
Now, Kelsey offers a really cool service where she actually comes to your house, brings her table, which we are sitting on in my house,
yeah,
and can assess and then can give you some exercises and can give you some ideas and ways to strengthen it, bring it back closer together. And so Kelsey's going to just show us how you can do a little self-assessment at home to see if this is an issue, and then give us just the very first start of some exercise that you can do on your own.
Yep.
But if you need a little assistance, have Kelsey, a physical therapist, come to your house and show you what to do.
I show up. You don't have to find childcare. It's really important for moms to have access to a high quality care. What I will say that I've seen is, especially people who can't get theirs to resolve, there's a lot of mechanical reasons for why it might not be able to close. So if you have a lot of muscle tightness on one side of your back or your hip flexor, or if you've had a cesarean section and your scar tissue, you have more on one side than the other. If you have a pelvis asymmetry or an SI joint problem where you actually have one side of the pelvis that kind of gets stuck in a rotated position, all those abdominal muscles, that rectus abdominis attaches on the pelvis. So there's a lot of things that if you feel like you're not making progress or it's not resolving, you probably need to get not just exercise, but some manual therapy intervention as well, so that you can give that muscle every opportunity to come back together.
Awesome.
Okay, but the self-assessment's really easy. You don't even need me to check for it. So I'm going to teach Carly here how she can check for hers, okay?
All right.
All right, so you're going to lay on your back. And then just a good self-assessment. So you can find your belly button. And then if you come out, you're going to get to a point where you sort of feel the border of muscles that are running this way.
Okay.
So that's your rectus abdominis. So you get an idea about where it is. It's actually what we want to do is feel the separation with the muscles contracted. It's also a lot easier to feel when they're contracted. So you're just going to lift your head up a little bit off the table. That kind of makes those muscles contract. And then you can kind of feel. So normally you want that separation to be 2 centimeters or less. So no more than, say, 1 to 2 fingers widths. We measured Carly's before we started this video, and she's rocking a 4 centimeter. She's my newest patient here. So just again, find your belly button, come over till you feel kind of the borders of the muscle. If you don't feel it, you will once it's contracted, and then go ahead and just lift your head up, and then you can kind of see. So again, Carly's got probably about a good 4 fingers width between the two, or about 4 centimeters. What we ideally want is it less than 2 centimeters, and you want that by, if it's still greater than 2 centimeters beyond 12 weeks, that's when you know you have a problem, okay? So what we want to do, and very easy exercise to kind of help heal this, is we're going to work something, not the rectus abdominis, which runs vertically, a deeper muscle called your transverse abdominis. So that's when people refer to your core muscles. That's one of the big ones they're talking about. It actually runs this way like a back brace. So that's the muscle that when it's contracted is going to help pull the 2 separated sections back together. And it's, like I said, it's really one of your main core stabilizing muscles. So even if you don't have a diastasis recti, it would just, these exercises you could do just during pregnancy and postpartum, just because everything's getting stretched out and weak when we're pregnant. So it's just, these are great things to do even if you don't have the separation. Okay? Sure. So go ahead and we'll teach this one on your back. So go ahead and bend your knees. If you are in late stages of pregnancy and you don't tolerate being on your back, don't worry, because I'll show a different, sort of a modified version, okay? So, I'll give you, sometimes this is really difficult to know, am I doing it right? It would be much easier if I said, do a sit-up or do a crunch, because something happens and you know I'm doing something. This one, it's not hard to, it doesn't take a lot of force. You're not going to work up a sweat. It's more just, it's hard to know, am I doing it right? So we'll try a couple different ways. What I think helps is if you take your hands and wrap them kind of around, right above your pelvic bone, right around, yeah, perfect. So what I'm going to have you do, and I'll just maybe explain first, is you're just going to take a normal deep breath in, and then on your exhale, you're going to try and tighten everything under your hands. So you should kind of feel it kind of wrapping around. What I think is helpful is feel what it's like with your fingers pushed down.
Okay.
When it's not contracted.
Okay.
Okay? And then you're going to take, and I'm going to help monitor here. So you're going to take a normal deep breath in. On an exhale, try and tighten everything under your hands. That's perfect, but don't hold your breath. So that was great, but you lost it on the exhale. So we're going to try again. It's really hard to dissociate, your diaphragm from your abs. So that's why I intentionally have you do this on an exhalation, so you don't just, I'm doing it, right, but I'm not breathing. But you got it. Some other really helpful cues can be, think about, you want to almost pull the pelvic bones together. Another really good one is the tightening that you get in your abdominals, as if you were going to fog up a mirror. So if you were going to get right up to a mirror and do that sort of, that tightens up that lower abdominal, that transverse abdominis. What you don't want to see is any movement of the pelvis. This is not a pelvic tilt. That's using the larger abdominal muscles. Nothing should happen. So no movement of the pelvis, no lifting of the shoulders.
Okay.
So we'll try again. You're going to wrap around. Nice regular deep breath in. On an exhale, try and tighten everything up around your hands, like you're fogging up a mirror, and relax. Do you feel like do you feel a contraction there?
Yes, but it was hard.
It was hard?
Yeah.
Let's try one more time. This time really think about like not letting those fingers sink in the front. Sometimes that can really help. So what do you need to tighten up so that I can't sink my fingers in here?
Okay.
So regular breath in on an exhale. That's fantastic. You got it.
Okay.
Rocking it.
The fingers helped.
So everybody has a cue that works better for them. So that's why I try and give a lot, because sometimes that helped you.
Yeah.
Okay. The other way I'm going to show you, I think, is actually a little bit easier, because you can kind of feel something happening a little bit more. So we'll go over that next. But I like showing it in this position because once you know how to contract it, I tell all of my moms, this is your car exercise. When you say, I don't have time to exercise, I'm a mom and I get it, do this when you're sitting at a red light. Do this when you're driving your kids around, so you don't need any equipment. Once you get good at it, I would say for Carly, start maybe just seeing if you can hold it for 10 seconds. So a couple breaths in and out. But what you want to do is increase your endurance of that muscle. So can I start holding it for 20 seconds or 30 seconds? Can I make it all the way through this red light? And you want to keep normal breathing. That's important. Don't hold your breath.
Sure.
Okay?
Awesome.
So the next exercise, again, if you don't like this, or if you're very pregnant and don't like being on your back, you can also do this in a hands and knees position.
Okay.
Okay, so we're going to get in a hands and knees position. You want the back to be nice and flat, so you don't want it rounded or arched. And no one likes to do this. No one feels very attractive when they let their belly relax, but you're going to go ahead and try and see if you can just relax the muscles of your belly down towards the floor, but don't let your back move, okay?
Okay.
And now you're going to do the same thing. So you're going to take a normal breath in. On an exhale, you're going to pull the belly up towards the spine. And now pull up, but don't round the back. So there you go. So, and again, you can sort of hold this 5 or 10 seconds, maybe through a breath or two. You know you're doing it right if the belly's lifting up and the back is not rounding. If it starts to round, then you know you're using the wrong muscles. So I think that can be a little bit helpful, because you can actually feel your belly moving. You know that you're doing something. You get a little bit more feedback about what you're doing.
But so starting small. I mean,
Yeah.
I think so many people jump right into crunches and hitting the gym and running, and what you just had me do was so tiny,
Yeah.
but it was hard.
It is, because you're targeting these, like I said, it's a smaller core muscle. Now, what you don't, I'm glad that you mentioned that, because if you know you have a separation, those are things you do not want to do. So that muscle that's now in 2 pieces and separated, you don't want to overstretch that, and you don't want to forcefully contract it, because doing those 2 things could actually pull it further apart. So no sit-ups, no crunches, no planks, no laying on your back and lowering both legs at once. And I would also just say, avoiding any jumping, running, any high impact stuff, any twisting through the trunk, because that could, start to pull it apart. And then if you like yoga, I would avoid any of your upward dog or your standing and just sort of leaning back. Those types of things will put too much of a stretch on the front. And lastly, if you do have one, you will find some mixed information on the internet about the use of a binder. I will say in the patients that I've seen, the binder combined with these exercises helps tremendously to reduce the time it takes for that separation to heal. So there are some great ones on Amazon that are like $15, just something soft and like I said, it just kind of wraps around in the front. You can kind of see why that would help sort of pull things back together and give you the support that you're missing while you're waiting for this to heal, to kind of minimize your risk of injury when you're lifting and carrying your kids.
Well, thanks for stopping by, Kelsey.
Yeah, thanks for having me.
I'm going to put the links to Kelsey's website and Facebook in our post, and then that way you can give her a call if you need anything at all.
And I will make sure that Carly gets to work on her 4 centimeter
starting
separation.
my services next week.
so that she is not at more of a risk of injury, and she can keep helping all of you. So,
all right. We'll see you next time.
Thanks.